And a very warm welcome to the podcast, Dr. Joseph Rosado. How are you today, Dr. Joseph?
I am excellent. How are you, sir?
Wonderful. So let's get this started, as I do with all guests. It's like the icebreaker. So where are you right now on planet Earth?
On planet Earth, as you would say, I am in north central Florida, a town called Ocala.
Ocala. Okay. Is that, do a lot of private strips in Ocala or near Ocala where they do this private jet flying? I don't know. I could be wrong.
Yes, there are because John Travolta lives in this community.
I was going to
Yes.
say that. Yes. Shh.
And he lives in a community that's obviously gated, but he has an airstrip in that community. So he because he's a pilot,
Yeah.
I believe he's a professional pilot if I'm not mistaken. And
Yeah.
so he has the capability of flying in and out of that area. But Ocala is known as the horse capital of the world
Okay.
because there's a lot of grooming going on here. There's a lot of mating, all kinds of horse activity that goes on in the Ocala area.
Right.
And so it's known as the horse capital.
Wow, okay. It's interesting because years ago I did a bit of flying in Florida, and just when the name you mentioned the name, I kind of went, oh, that sounds familiar. And I think this is pre 9/11. I think you were able to fly close enough to Mr. Travolta's property at the time, I think, or fly close by. Probably not anymore, but yeah, I think he has a Boeing 707. He's a few other, I think, airplanes. So yeah, big fan of aviation. So in terms of the horses, I mean, why Ocala? Why is it the horse capital? What's the reason behind that?
I don't know why the reason for that is. I just know that when you drive into the city of Ocala, it reads Ocala, horse capital of the world.
Okay, any listeners there, you can Google it. You can put it in the comments below as we release the podcast. You can find out. Even with John Travolta, you're more than welcome to add a comment below. So, what's the temperature like, especially for an Irish man at the moment, which is kind of, we haven't had sunlight, I think, for 9, 10 days. So,
Well,
what's it like?
today, this morning when I woke up, it was 53 degrees Fahrenheit, and the high was only going to go up to 59 degrees Fahrenheit. So it's a cooler day for us. But again, cooler day, but it's still February 20th. So where the rest of the world is dealing with, 20 inches of snow or, ice storms or things like that. We have no snow, we have no ice. We just have, less than 70, plus degree weather in our, neck of the woods.
Right. Okay. You're bragging now. Okay. So
Yes, I am.
so you didn't get snow because we were getting in the media there was snow around Florida. You didn't have any issues with that whatsoever.
No, that was more with what's called the Panhandle, which is
Okay.
northwest Florida. But also, there was some snow in northeast Florida, as far south, if you will, as Jacksonville. I understand that there was some snow that occurred in and around the Jacksonville area, which is northeast Florida. And then, of course, northwest Florida, which is the Panhandle, which is the border of Florida and Alabama. So, the main town there is Pensacola. The claim to fame for Pensacola is if you ever saw the movie An Officer and a Gentleman,
Oh yes. Yes, Richard Gere. Yes.
Richard Gere, exactly. So in that movie, the movie was filmed in Pensacola.
Oh wow. Okay. So that's why probably lots of white uniform suits around the area, is there?
Yeah, there's a few military bases there that are represented in that community.
Wow, cool. So any listeners there, get yourself over to Ocala. You'll have a wonderful time. You might see Richard Gere walking around the area. Who knows?
No, no, not Richard Gere, John Travolta.
John
Don't
Travolta,
confuse
sorry,
them.
and Richard Gere. They're best buddies. No, they're not. Okay, I don't know. So I gave our little listeners a little bit introduction about yourself, Dr. Joseph. Can you tell listeners a little bit more about your background and how you entered the medical
Absolutely.
profession?
Sure. So my medical career began at the ripe young age of 16 when I became a certified nurse's aide, also known as an orderly. My first job was working in an assisted living facility where I supported the nursing staff with lifting of the residents. Not a whole lot of learning was going on, just a lot of brute force, brutal work. Not really what I was interested in doing. That being said, um, I applied for a transportation orderly role in a local hospital where we transported patients from their rooms to the X-ray department for their diagnostic procedures, radiographical procedures, and then back up to their rooms. And that I enjoyed tremendously because when we had downtime, I was able to then sit in the rooms where the radiologists were interpreting the diagnostic studies. And so here I was, 16, 17, 18 years of age, watching these individuals looking at the radiographic studies and doing the reading and interpretation, looking for pathologies, things like that, but also just basic anatomy. And so I would sit there and listen to them dictate, and I, learn to look and see what the lungs look like, what the heart looked like, the gastrointestinal tract, the brain, different areas, and the amount of education and learning that I got there. I could never at that age get it in a book because I was in what we call high school. And so that was really my introduction to healthcare and medicine. And then from there, I progressed and became an emergency medical technician, working on an ambulance, moved on and became a paramedic. And then from there, worked as a what's called a heart catheterization lab technician. Say that three times fast,
Yep.
where we were doing procedures to determine whether there were blockages in the arteries of the heart, as well as peripherally in the upper extremities, lower extremities, arms and legs, and as well as determining if there were any issues with the valves or any problems with the electrical system of the heart. And we would treat and manage them doing very advanced and invasive procedures, which again was amazing because I was now, working shoulder to shoulder with cardiologists, and we would see what was going on, and the ability to learn and work with issues and diseases of the heart, excuse me, was absolutely phenomenal. It was just an amazing experience. While doing that, I was also going to school. I was a pre-medical student getting prepared to take my entrance examinations to go to medical school. Unfortunately, or fortunately, depending on how you look at it, I was involved in a pretty severe automobile accident that rendered me partially paralyzed from the waist down due to a fracture, a compression fracture in my lower back area. And I went to see a chiropractor that I had seen years before for a sports related injury. And that individual uh, made me feel so much better following the accident than I was even before the accident that I opted at that moment to not go to medical school and go to chiropractic school. And so I started chiropractic school in March of 1989. I graduated in September of 1992, uh, practiced in the state of Florida, then moved to the state of Ohio, which is somewhat Midwest, if you will. Um, and then from there, because I was not a fan of the winter or the cold, I moved to Arizona. That's where my twin daughters were born in 1996. Uh, Shortly thereafter, I became very frustrated with the limited scope of practice of chiropractic medicine, and I opted to go to medical school at that time. So I started medical school in the fall of 1997 and graduated in 2000 because they had um, accredited and allowed certain of my credits to be approved as part of my education. And so I graduated in 2000. I worked as a hotel physician in the Dominican Republic, uh, did social service, did some additional training, and then we had a little situation called 9/11.
Yes.
And so that changed the whole idea of tourism and anything related to travel. And so I returned to the United States. And from that point forward, I did multiple things. I was involved in clinical trials, clinical research for diabetes, specifically diabetic neuropathy, nerve involvement secondary to issues with diabetes. I lived in Costa Rica and was one of the team physicians for the Costa Rican sports and the Costa Rican Institute of Sports and Recreation, as well as um, triathletes, biathletes, Olympic athletes, as well as football players. The men's and women's national teams. I worked with the Special Olympic teams. So I did a lot of work combining my chiropractic skills and knowledge and my medical skills and knowledge. I did that for a while. And then I returned to Puerto Rico, which is where my ancestors are from. Did a 1 year internship program there on the island, and then returned to the United States, where I began working as a communicable disease director for a county health department, where I oversaw the immunization department, the epidemiology department, the sexually transmitted disease department, family planning, and HIV/AIDS clinics. Then from there, I worked as a clinic director for a community mental health, where we managed patients that were what's called dual diagnosis. They had addiction issues as well as psychiatric issues, where in reality they were one and the same. The reason they had addiction issues was because they were self-medicating to treat their psychiatric disorders.
Right.
Then from there, I worked as the medical director for a community hospital, worked um, very extensively in the community, providing services to a rural community, rural area, working with foreign doctors that were coming to the United States to obtain what's called a J-1 visa, which are visas to be able to practice medicine in the United States in underserved, underrepresented areas. Uh, I was in practiced hormone replacement therapy for males and females, addressing what's called menopause in women and andropause in men. Because in men, for example, from the age of 25 on, we produce 2% less testosterone every year. So
Wow.
at the age of 50, mathematically speaking, you are 50% the male that you were at the age of 25, and that's where you have the decreased libido, the gaining of weight, in the belly area. Um, some men grow what are called man boobs,
That's me. I've moved, moves, moves.
And so I did that from 2010, 2015 to 2015-ish to 2016. Uh, in 2014, uh, the a very popular and influential attorney in the state of Florida by the name of John Morgan began advertising the use and the decriminalization of cannabis for medical reasons in the state of Florida. And so I reached out to him, letting him know I'm a physician, I'm an advocate, how do I get involved? Within 24 hours, I was speaking with the campaign manager. A week later, I was on the Bureau of Speakers, and literally the rest was history. Unfortunately, it did not pass because we brought it in as a constitutional amendment, and the rules in the state of Florida are that if you are going to apply for a constitutional amendment, you need at least 60% yes votes.
Okay.
And we had less than 2 percentage votes we missed it by less than 2 percentage points. And so we went back to the drawing board and went back uh, again to the ballots in 2016. But that afforded me 2 additional years to prepare better and work and travel and learn from other physicians that had been utilizing medical cannabis for adults and children. And then in August of 2016, I was the first in the greater Central Florida area to recommend medical cannabis to a 35-year-old female who had a brain tumor. And then 3 months after that, in November of 2016, I was the first in the state of Florida to recommend medical cannabis to a child, a 15-year-old boy that had a very aggressive head and neck tumor that had eaten out a portion of his jaw, his cheekbone, his eye socket, his eyeball. He had to wear an eye patch. Um, he spoke kind of hoarse because the tumor had pushed the vocal cords, the trachea, and the esophagus, so he had a bit of a hard time swallowing. Uh, it had also penetrated the skull and into the brain, and he was on a morphine pump where he was being given 16 milligrams of morphine every 4 to 6 hours. But in between, he was able to give himself a rapid dose of the morphine to address the pain that he was having. However, once we started him on the medical cannabis, within 30 days, we were able to cut the dose from 16 milligrams down to 8 milligrams. He was no longer confined to his bedroom on his hospital bed because he was already on hospice at the moment that he started as my patient. He was now able to leave the room. He was able to participate and engage with his family. Was asking his mother to make him rice and beans and meat because he was hungry. He was laughing. He was jovial. He attended his brother's wedding, was the best man at his brother's wedding, danced with his sister at his brother's wedding. And in fact, 8 years ago, yesterday was when he transitioned from this plane to the hereafter. So February 19th of 2017 was when he passed away. But the quality of life that he lived and he was able to enjoy from November when he started the medical cannabis care until February 19th when he transitioned is truly priceless. No one can really label what it was. And then shortly after he became a patient in November, Amendment 2 did pass, and it was signed into law in June of 2017. And it's just evolved and progressed from there in the state of Florida. My journey has continued with and promoting medical cannabis, not only in the United States, but all over the world. I've traveled to and spoken at the following countries: Costa Rica, Colombia, Mexico, um, Fiji, Thailand, Malaysia. Um, and as a result of my involvement with children, pediatric patients, a special needs mother by the name of Deborah Downey in your neck of the woods in Ireland,
Hello, Deborah.
who had a special needs daughter, beautiful angel by the name of Abigail, and this child had a condition called Dravet's, which is intractable seizures. These are children that have anywhere between 200 and 300 seizures per day,
Wow.
and
Okay.
this child was just a beautiful spirit, a beautiful soul, born we believe to be normal. You know, she was fine, she was engaged, she was speaking, and at a specific time in her life, she began to have these seizures, and no one could really figure out or understand what was going on. And together with Deborah, there were some other special needs moms that were in the same boat. They participated in a program where they were able to receive medications from Amsterdam through the Irish government, they had some type of a special arrangement between Amsterdam and Ireland to be able to provide the cannabis-based medication to these special need children. The challenge then became that no physicians in Ireland were able to manage these children because in the regions where these children were located, because they were not familiar with dosing or treating these children with their conventional medications, how the cannabis would interact with, or what to do in conjunction with their conventional medications. And again, Deborah, being the good Irish woman that she is, she raised all kinds of you know what and was instrumental in um, allowing me to have privileges at the facility where Abigail was frequently seen and managed and treated by these specialists, these, physicians. And once we were able to get her on the cannabis, Deborah's own words were that she had gotten her daughter back
Right.
because once we were able to control the seizures with the conventional medication and the cannabis, but then started lowering the anti-epileptic drug dosages and increasing the medical cannabis dosages, uh, Abigail was more awake, more alert, was interactive with the family. And so it was just a beautiful scene. And yes, unfortunately, as happens, this little angel also transitioned. But again, the quality of life that Deborah was able to have with Abigail and Abigail's quality of life, the memory of her older sisters and her mom and everyone else in the nucleus, as well as in the community, was again priceless because this child, they saw what she was going through, and then to be very calm, very peaceful, and able to engage was, remarkable, for lack of a better term. And so that was, as a result of that, Deborah has been very instrumental in introducing me to other individuals in Ireland that have needed my services. And she's been very, very supportive in promoting the books that I've written. Thus far I've written and published 7 different books. The first one was published in April of 2019. It's entitled Hope and Healing: The Case for Cannabis, available on Amazon as well as other bookstores. And then in 2024, I published 6 additional books on the topic of medical cannabis. Those Each book is a disease specific condition. So it's chronic pain and medical cannabis, epilepsy, seizures and medical cannabis, multiple sclerosis and medical cannabis, anxiety, depression, post-traumatic stress disorder, behavioral mental health and medical cannabis, and cancer and cannabis. So there's a book for each one of them. And then the 6th book is a compilation of all of those 5 books together for individuals that are in the healthcare profession that see and manage patients with every one of those conditions to help them and support them to be able to address these people.
That's amazing. I mean, I was gonna ask you, why as a 16-year-old would you get into this, and was there family background? Did your folks or somebody in the family were they in the medical profession, or was it just from day one you went, oh, I want some of this. I want to help people.
Yes and yes. My father wanted to be a physician, um, but at the time, he and my mother married in 1959 in Puerto Rico. And at the time, because he was Puerto Rican and they transitioned and moved from Puerto Rico to the mainland, to the upper 48, as they're called. Um, at that time, there were quotas, if you will, and they allowed certain number of individuals that were not white Anglo-Saxon Protestant or just whites into certain professions. And so he, he went with an alternative plan. He became an X-ray technician, a radiological technician, which in essence kind of opened the path for me to work in the radiology department because it was kind of like paying homage to my father, being in the X-ray department as a 16-year-old, and then growing up with my dad and going to the hospital with him and seeing him work in the X-ray department. So that's one, I had the influence of my dad, but I had another incident that occurred prior to that when I was a very young man. I was 3, 4 years old, and I had experienced now as an adult, as a physician, I can claim it and name it. I had post-traumatic stress disorder due to having received so many shots from birth to the age of 2. At that time, I was born in 1962. And so at that time in the United States, whoever delivered you was responsible for vaccinating you. Well, I have always been and am a visual learner. And so as my mom was transporting us from our apartment to the doctor's office, I quickly learned the route to the doctor's office and I started seeing things. And the minute I started recognizing certain objects and items, I began to get out of control.
Right.
And I would walk into, we get into the office. It was an old school type of practice, no appointments. There was a sheet, a yellow sheet of paper. And when the ladies arrived, they would write their name on the sheet of paper. And that was the order that people were seen. So it was not uncommon to be sitting there 3, 4, 5 hours, and the entire time I would be disruptive, screaming, yelling, carrying on. And then when I finally did get to taken to the back, then that's when the real war began because now they had to recruit people to hold me down to allow me to get the shots.
Right.
And it got to the point where the doctor told my mother, look, you're going to need to find somebody else. I cannot handle him coming to my office anymore. Your son's just too disruptive. I'm like, well, yeah, you give me a damn shot every, 2, 3 shots every time I come in here. And so he gave my mother a reference of a pediatrician. And during a family meeting, dinner, my mother mentioned it to some friends and family members of ours. And one of the ladies there said, oh, he's my second cousin. He's an amazing doctor. You're going to love him. And so when I went to his office with both my parents, it was no big deal because I didn't know where we were going. We
Right.
get to the office, but again, in the city in New York City at that time, doctors' offices were primarily in apartments. And so we get to an apartment. It looks like we're visiting somebody. I'm with my mom and dad. We walk into what I thought was the living room, which was really the waiting room. And then he came out, did not have a lab coat, so I could not determine or see if he was or what he was. He just came out, dress, shirt, tie, dress slacks. We walked through the apartment. We walked through different rooms that have, medical books and magazines, and I'm seeing all these different things. Um, Walk through an office space with a desk. Nothing really stands out. Then I go into the last room, and that's where I see the examination table. I see the table with the diagnostic tools. I see a refrigerator. I see a scale. Now I'm starting to panic a little bit. Now it's like, okay, wait a minute. I'm in a doctor, like I'm in an office, and I'm looking around, looking for any shots, any needles, but I'm not seeing anything. And so they sit me on on the exam table. He's talking to my parents, and he's like, okay, well, let me talk to Joseph. As he started walking towards me, I immediately went into the mode of, I don't want to be here. I don't like what's going to happen to me. And instantly, both my parents reached over to do what they are accustomed to do, which was hold me down.
Right.
Except this time, this individual said, don't hold him. And now in my, 3, 4-year-old brain, I'm going, this is different. The other guy was like, hold him down. This one's like, no, leave him alone. I'm like, okay. And so he had an otoscope, which is what you used to look in the ears, but also has a light to look in the throat. And he had a tongue depressor in his other hand. And he handed me the instruments and said, here, examine me. And
Right.
I went, what? And he's like, yeah, examine me. Now, remember, I'm 3, 4 years old. This is a grown man. So to me, he's just towering over me. He squats down and now we're looking eye to eye, hands me his tools. I hold the tools. He opens his mouth. I make believe I know what I'm doing. But in that instant, there was a familiarity with these instruments in my hand. And that's when I made a realization, this is what I want to do. I want to be a doctor. So I did what I did with him, and then he's like, okay, now can I examine you? I'm like, sure, here you go. So I handed him the tools. He examined me, listen to my heart, listen to my lungs, examine head to toe. And so now I'm like really antsy and am expecting the shot. And he's like, no, you don't need a shot today. You'll be fine. I'm just going to give you some medicine and, your parents can take you home. This same individual, there were times when I was extremely ill and I could not leave the house. He would make a house call. He came to our home on more than one occasion in the midst of snowstorms and rainstorms in New York City on Sundays. And I remember it being, I know that it was a Sunday because we used to watch the Ed Sullivan Show,
All
like
right.
everybody else in the United States. And we would be watching the show. He would come in, would examine me, treat me, and if I needed it, I would get a shot because, an antibiotic or whatever. But he would explain it to me. And from that moment that he became my provider, I never had an issue with receiving any type of vaccinations or inoculations or just shots to be treated. And there was just this camaraderie in this relationship. And so what occurred to me at that young age, and then my dad being in the health profession, those in essence combined to allow me to be who I am. And of course, I went the long way, I took the long road, but I ended up being who I am as a result of those experiences.
Those experiences as well, Dr. Joseph, I mean, do you think those experiences kind of you've carried them on yourself? So if you see your own patients, would you have you encountered maybe a similar scenario where you've seen a 4-year-old child that's like, worried about they're going to get a booster or some sort of procedure done? I mean, do you hand the control back to the child by saying, we're
Oh
okay?
yeah. Oh yeah, absolutely. That served me very well. I've done that not only with children, I've done it with adolescents, like not only with toddlers, but I've also done it with adolescents and some adults, adults that have dementia or are not all there or special needs, I'll do, I'll implement and utilize the same idea and the same tactic. But something that occurred a few months ago, last year, I was invited to speak in Washington, D.C. for the Indigenous Cannabis Industry Association. I was one of the keynote speakers, and in the evening, there was an after party, if you will, and one of the speakers was there with his wife and their child. And the little girl, I would say, was about 3, 4-ish, give or take. And so when I walked in with two friends of mine that happened to be attorneys. And so the three of us walked in, and this gentleman came over and say, "Hey, Dr. Rosado, I want you to meet my wife and my daughter." And so he introduced me to his wife. I shook her hand, and then when he introduced me to his daughter, I immediately, just out of instinct, didn't even think about it. I squatted down to be at her level. I put my hand out and said, "How do you do?" And I used her name, and she looked at me and she shook my hand, and then she gave me a hug, and I hugged her back. And then I said, "So, how old are you, and where are you from, and where do you live, and are you going to school?" And then a tactic that I learned from one of my best friends, who is a pediatrician, where he jokes with them. It's like, "So, are you married? Do you have any children? And, where do you work?" And so I'm doing this to this little girl, and she's looking at me. She's like, "I'm a little girl. I'm not married. I don't have any children." And as I'm carrying on, one of my friends who's an attorney says, "You can tell that he is a family doctor. Look how he manages these children, or how he managed this child." And it was just instinct, but it's something that's inside of us. And, I had a meeting this morning with the CEO for the company that I work with, and the COO, and we were talking about physicians that were looking to begin a new project in the company, and we're looking for certain doctor, certain caliber of physician. And he said, the CEO said, it's very difficult to find physicians that are compassionate, that are coming from a place of connection and connectivity with their clients, with their patients, rather than coming in from a scientific point of view where they're so analytical
Yeah.
and they're speaking in medical jargon that they are not able to connect or interact with their clients, with their patients. And so that was, something that I've been blessed to have that capability to be able to connect with people in that way. But I've also done a lot of self-help, a lot of work, done a lot of self-improvement seminars, a lot of communication seminars that have allowed me to work better and closer with not only my patients, but also staff and administrators.
I'm sure they appreciate that as well, because as you said correctly, there is times, and this is no disrespect or pointing the fingers at any physician or doctor, but when the information just comes at you and you're kind of like, what the hell does that mean?
Yeah,
Rather than having that kind
and
of
I mean, I'm a doctor, but I'm also a patient. I get sick. On occasion, I've gotten sick. I've had COVID 5 times already.
right.
You know, I've had my share of issues in my lifetime, and I've had providers come in and talk at me, and I'm like, wait a minute, like, why, what's going on here? Why are you speaking to me that way when you know who I am? You know what I do. Like, why are you talking at me that way? Like,
Bring it
either,
down a level. Yeah.
yeah, like either demeaning me or
Mm.
or talking down to me. And say, well, you're the patient. I'm like, yeah, I'm the patient, but you cannot deny the knowledge I have and the schooling I have. Like, it's like, you don't need to treat me that way. And I'm like, if you're treating a colleague like this, I hate to think how you treat anyone other than a colleague. Like, wow.
Must be burnout as well. I mean, I know there's the professionals, and this is not making excuses for anybody, but I think when you're under so much pressure, I suppose in any job, you do fall into that kind of trap where it just becomes kind of like robotic. Patient comes in, what's wrong with you? Medication gone. Patient comes
Uh-huh.
in, what's wrong with you? Medication gone. The thing I want to chat about there, which is pretty much the main topic of our conversations today, which you've touched on earlier on. Um, for anybody listening to this, I mean, obviously there is so much kind of information in relation to, say, cannabis or marijuana, all this type of stuff. I mean, to keep it as simplistic as possible, as we've just spoke about just there, what is cannabis? Is
Okay.
cannabis marijuana? Is marijuana cannabis? What is
All
it?
right. So the correct term is cannabis.
Right.
Okay. Named after looking at the plant world, the mother plant is Cannabis sativa L. Okay. And then cannabis sativa L had two children. You have uh, hemp and cannabis.
Okay.
Hemp is primarily used for textiles, for clothing, for ropes, for cement, a lot of replacement for paper. But also, you can extract oils from the hemp plant and create oils that are medicinal because the hemp plant is very rich in what is called CBD or cannabidiol, which is the non-euphoric component of cannabis. Does not cause a sensation of being high. Okay. So it's very rich in CBD, cannabidiol, as well as other phytocannabinoids. Phyto meaning plant, cannabinoids meaning that they work on receptors in the body that are have an affinity for the cannabinoids. Now, I'll pause there to state that we all have what's called an endocannabinoid system. And what does that mean? What that means is that we all vertebrates produce cannabis. So dogs, cats, giraffes, elephants, humans, we all produce cannabis. Children, adults, we all have an endocannabinoid system. We all produce cannabinoids that work on these cannabinoid receptors. As we age, or as we develop dis-ease or lack of ease, we have a deficiency in these substances and end up with what's called clinical endocannabinoid deficiency. And so we need cannabis from the outside exogenously to work inside, to work in and on those receptors. So, so unpausing. So now we have hemp that's primarily CBD, non-euphoric for textiles, but also has some medicinal value, some medicinal purposes. And then you have cannabis. Cannabis then is a species. And from there you have subspecies. And those subspecies are indica, sativa, and ruderalis. Okay. The cannabis plant is very rich in THC, which is the phytocannabinoid that causes euphoria. And if cannabis were a cowboy movie, an American Western cowboy movie, the THC would be the cowboy dressed in black, and CBD would be the cowboy dressed in white, because everyone wants to praise and hail CBD and villainize THC. The
Yeah.
reality is that they both have extremely powerful medicinal value. In Europe, for example, there is a medication called Sativex, which is a trade name. The generic name is Nabiximol, which is a 1-to-1 CBD THC ratio, which is approved for individuals that have chronic muscle spasms secondary to multiple sclerosis, but also has been used for other conditions such as ALS or Lou Gehrig's disease. Um, They've used it for seizures. They've used it for individuals that have had chemotherapy and have nausea and vomiting as a result, because it's an oral mucosal administration. It's an oral spray that's utilized and absorbed in the oral mucosa or in the mouth. So that is approved in certain countries in Europe, not approved in the United States. Um, but that does come from the plant. It truly does come from the cannabis plant. There is another medication called Epidiolex, which is what's called a CBD isolate. It just contains CBD, and that comes from the hemp plant. That has been approved for Lennox-Gastaut and Dravet, which is the condition that I mentioned earlier that little Abigail had, one of the conditions she had. And so CBD has been used extensively on children primarily that have these intractable seizures because they have found that it works very well for the management and treatment of these children with seizures.
So for this is me just kind of being as open as possible to ask you something because you hear so much information out there. What about like for somebody that has Alzheimer's or dementia or I mean, is that a possibility as well? I mean, is it a case of just comforting the patient or is it a case where the patient will improve?
Well, studies have been done where they have shown that the phytocannabinoids, specifically CBD and THC, but also another one called CBG, which is the mother phytocannabinoid. All phytocannabinoids stem from CBGA and then become CBG, but that is 5 times more powerful than CBD as an antioxidant and an anti-inflammatory. And the fact that they cross what's called the blood-brain barrier, they are able to work on the receptors found in the brain. And once they are working on these receptors in the brain, they help prevent the deterioration of what's going on in the brain in individuals with Alzheimer's disease. Studies have been done with rats, aged rats that have the gene for late onset Alzheimer's disease. They've also done clinical trials with humans with a medication called Hyalalex that was formulated by an Indian pharmaceutical company that has branches here in the US where it is cannabis, turmeric, and melatonin. And they were doing clinical trials with that medicine in the Commonwealth of Puerto Rico, a US territory. And so it's on patients with Alzheimer's. So there are studies showing that the use of cannabis is favorable in preventing the deterioration of the dementia, the progression of Alzheimer's disease by blocking the what are called the tau proteins, which cause the amyloid plaques, which are what lead to the issues in the brain.
So this CBG, I mean, is this like a pharmaceutical grade type of thing? Is this available like in globally or are we back to kind of certain restrictions in certain countries?
We are back to certain restrictions in certain countries. In the United States, we are under what's called the Farm Bill 2018. It was signed into law by in 2018 by Donald Trump when he was the 45th president of the United States. And by signing into law the Farm Bill, what that allowed was for the extraction of products from hemp because prior to the farm bills, hemp was not allowed to be grown in the United States. And so what had to happen was people were purchasing hemp or raw material from the Ukraine, from China, bringing it to the United States. Extractions were being done in the United States, and then these oils were then being sold over the counter. The challenge was that in those countries, they use certain chemicals that are not utilized in the United States. For example, certain pesticides, but also heavy metals, because hemp is very good at cleaning the soil and it absorbs toxins that are found in the soil. Um, it has been noted that what occurred in Chernobyl, the nuclear spill, for them to be able to plant, they grew hemp to clean the soil and then allow for vegetation to be grown. So because of that and its affinity to kind of soak up what's going on in the soil, there were issues with heavy metal poisons or heavy metal toxins such as lead, mercury, etc. And so for that reason, um, Farm Bill 2018 was signed into law, allowing for the growth of hemp in the United States. And once that occurred, then they were able to extract the phytocannabinoids from the hemp plant and sell those over the counter without any regulatory issues or challenges. Now, they also say that for it to be considered legal, it cannot contain more than 0.3% THC. So if it's 0.3% THC or less, then that is allowed to be sold over the counter and that is legal. Anything that contains more than 0.3% THC is considered wrongly, erroneously cannabis. It is not cannabis, it's still hemp. It just has a higher legal percentage. So that percentage is not a botanical definition, it is a governmental definition.
Right. And with cannabis in general, especially with say patients you've dealt with over the years, I mean, is there any negative side effects or is everybody getting unique depending on their situation?
Everyone is unique, but the most common side effect is dry mouth, cotton mouth is the first thing. Second thing is if depending on the amount of THC that it contains, it can cause a certain level of euphoria. If the individual overindulges and is utilizing more THC than they are accustomed to using, then they can experience what's called greening out. And that greening out is defined or described as multiple symptomatology, multiple symptoms. So, together with the cotton mouth, dry mouth, they can experience some anxiety, they can experience some paranoia, they can have hallucinations, they can experience an increase in their blood pressure, they can experience an increase in their heart rate, their pupils will become dilated, and with all of these symptoms going on simultaneously, they feel and think that they're going to die. And so they call the emergency medical services. The paramedics arrive on the scene. They see what's going on. They get a good laugh. They take them to the emergency department. And now in the emergency department, they are labeled cannabis. The diagnosis that's used is cannabis use disorder. It
Okay.
wasn't really cannabis use disorder. They just greened out because they were grossly inexperienced. And somebody at some dispensary told them, oh, yeah, this will be fine. You're not going to feel high.
So generally, in your own opinion, it should be controlled in terms of administration.
And my opinion is that it's medical, it's
Right.
medicine. There are individuals, for example, and I've seen patients that come in that are veterans from the Vietnam era that have been utilizing cannabis since the late 60s, early 70s. There's really not much I'm going to bring to the table to educate these individuals because they've been using these products for a good 40, 50 years. Now, fast forward to the mothers like Deborah, the children like Abigail, other children that I've managed and treated, the Alzheimer's patients, the grandma and grandpas out there that have never utilized any cannabis, those cannot walk into a dispensary and say, yeah, I'm having anxiety, or I've got Alzheimer's, or I've got Parkinson's disease, or my child has seizures, or my child has cancer. What do you recommend? That individual is ill-equipped to educate and navigate through the process with a mom, dad, or caregiver because they don't know the condition, they don't know the disease, they don't know what medications this individual is or are on because usually they have more than one medication on board. And so these are things that need to be taken into account and into consideration.
Right. Okay. I'm on your being nosy here, Dr. Joseph, on your website, josephrosadomd.com. And you mentioned already you have your book there, which is Hope and Healing, the case for cannabis. You have information on there. There's services. You have one thing that kind of kind of popped out of me there. What's ketamine therapy?
Ketamine therapy is the new therapy that I alluded to earlier that has been approved by the Food and Drug Administration of the United States uh, for the treatment of treatment-resistant depression. And treatment-resistant depression is defined as depression in an individual that has been on at least two different medications and continue to experience depression.
Okay.
And so that's one of the qualifying conditions. The other qualifying condition is PTSD or post-traumatic stress disorder, as well as suicidal ideations. Those are the three conditions that have been approved to be utilized. And it's similar to a psychedelic in that the person will dissociate, they will have visions, they will see and or hear things. Um, but the key to it is that ketamine, similar to cannabis, but to a greater extent, causes what's called neuroplasticity. What that means is that it forms new brain cells. So it creates new brain cells, and by creating new brain cells, now you're creating new synapses, new connections between one brain cell and another brain cell. And by doing so, it allows for the shedding and the replacing of the um, nerve cells that are carrying a lot of the memories from their past that have caused them their trauma. Also, science has shown us that when individuals are deeply depressed, they begin to lose and shed brain cells. And so, by adding and incorporating this treatment to the individual, it allows for them to form new brain cells. And by doing so, it encourages a healing process. So consider, if you will, doing Control Alt Delete to your brain.
Right.
That's in essence what ketamine does.
It's fascinating. I mean, if anybody's listening to this today, I mean, what's the best way to get in touch with you? I know you have your links there for Facebook, LinkedIn, and I'm assuming, I don't assume because you make an ass out of you and me, but generally, I'm assuming that you pretty much don't have time to do the social media stuff. So you probably have somebody behind or a team behind that's organizing that. But what is the best way, say, globally? Somebody listening to your podcast today. You mentioned Deborah before, that's in a country that is looking for a bit of help or assistance, what's the best way to get in touch with you and your team?
The fastest and easiest way to do so is through my website, josephrosadomd.com. Uh, on there, there is a way for the individual to send me an email or send an email. I've got a team that reviews these emails, and once they review the email, um, the person can schedule themselves for a free 15-minute consultation with me. Um, there's a calendar available. The individual can schedule themselves. And so if they have a condition or a loved one or a friend or someone has a condition that they think cannabis or ketamine would be of benefit, they can schedule a free 15-minute appointment with me to ask me and run things by me. I will be a very true New Yorker and be very honest and let them know whether it can or cannot help them. Uh, Again, because of the jurisdiction situation and my, not being licensed in certain countries or states in the United States, uh, what I typically do is I just give them general counsel, general advice. And I usually, it sounds something like this. Okay, based on the 9,000 plus office visits that I've had from 2016 to present, and based on the number of patients that I've treated with this condition with medical cannabis, these are the things they have done that have worked.
Right.
And so they take notes, and then it's on them to do and choose to do whatever they choose to do. I'm not telling them what to do. I'm not prescribing. I'm not doing anything that will cause me to break any laws in any countries. Unless, and of course, we find another Deborah Downey who will then do what she does, work her magic, and allow me to obtain this type of special credentialing and special permission to work as part of the team that was managing Abigail.
No, that's brilliant. I mean, Deborah Downey, if you're out there, you want to come on the podcast, we can talk about this if you want down the road about
Oh,
your.
she would love to. Just good luck keeping her quiet because
Oh, there's no issues with that. I've no problem. I mean, it's a great cause getting awareness out there and the information, especially to people that maybe are kind of desperate. They don't know where to go. They don't know what information that they need to get, and that's why I meant you're a fascinating human to talk to Dr. Joseph. So thank you so much for sharing today on the Wellbeing Group podcast. The podcast will release shortly, and I'll put all the links in that you can contact Dr. Joseph and his team. So thanks so much, Dr. Joseph, for talking today.
No, my pleasure. Thank you for the invitation, and I look forward to speaking with you in the future about any other topics that you may have in mind or any other topics that are affecting the health of the individuals, not only in the United States, Ireland, but the world.
Yeah, no, thank you so much. I'll definitely have you on again in the future. Don't worry. We'll definitely have more chats. Thanks so much to Dr. Joseph. Thank you.
My pleasure. Thank you.